Okay, here we go again. So moving on to the second part of this video series, maybe. I wanted to highlight a couple of things in your early textbook, the blue one. Looks like this. So on page 447, I thought this box 14.1 was helpful in terms of kind of listing the step and getting your thinking process going through this process of clinical reasoning and intervention planning. So review that, use that as a guide when you're working on these assignments. The next part I wanted to point you towards was box 14.2. That is on page 451. And that one gives you some questions to be thinking about and asking. It gives you the steps in the intervention process. If you get stuck, read through that to kind of get you moving again and make sure you're on the right track. These are just guides. They're not going to give you the answers or give you the end-all be-all, but it is helpful if you get stuck in the process. Okay? The last part I wanted to point out that as a nice reference is on page 456. There's this table 14.1, and that's just giving you, if there's a specific focus of intervention, it gives you possible goals for restoring, improving, establishing, okay? So again, just a way to kind of, if you get stuck, get your mind back on track or give you some ideas, all right? So the other resource that I think would be helpful for you is getting out your OT practice framework. Sometimes as you're going through this process, some of those terms can jumble up in your head in terms of approach to intervention, context, client factors. Get those out and review those. I still have to do that sometimes because when I'm busy thinking about one thing, I'm like, wait a second, what are approaches again? I got to look that up. So use your OT practice framework. Okay, so going back to the intervention plan template. So this is, again, where the thought process you go in order to get to know the patient. What is the patient's story? So you're going to list meaningful occupations and roles. Don't forget this. A couple of you forgot this on your, that part. Current performance skills and client factors. Now, you're not going to list every performance skill and client factors, but if there's a few that you want to be aware of, list those there, okay? The relevant ones that might be, maybe they're a problem or maybe they're a strength that you can draw upon. So list those there. Make sure you list something. Okay, strengths and problems. I think those are pretty self-explanatory. Try to put at least one or two things in the strengths and list your problems. There might be, it depends on how detailed or how broad you want to go with that, but list something there. It's kind of, this part of things is sort of, the intervention planning part isn't concrete. It's not black and white. It's sort of the art of occupational therapy. So that's probably why for some of you it feels kind of not very specific and kind of confusing at times. It's a bit abstract, but that's also the part that allows you as a therapist to really kind of put your own twist on your therapy. So this is what we're talking about here. I wanted to highlight relevant contexts and patterns. So what it's talking about here is table 5 on page S28 in your OT practice framework. Review that. Because Glenn has a very specific context that he is living in, a very specific situation. Okay, safety considerations, self-explanatory. So environmental compensations and modifications. There are already several environmental compensation and modifications in place. The OT has put some in, but just the fact of where he's living is going to have certain environmental compensations and modifications living in it. So therapeutic approaches, that, again, review your OT practice framework. Approaches can be table 8, but it can just be anything that you feel like is going to be helpful for you to remember in terms of how you're going to approach your treatment with Glenn, okay? Just some things to keep in mind. All right, I'm going to pause the video there before we move on to the next part.